Welcome back. Thanks for joining us on this Saturday here at Live Now from Fox. I'm your host, Carl Lahara. Let's get to some international and health headlines. I want to give you this, a live look out there in Gaza at the Al-Aqsa Hospital. And I want to talk a little bit about the efforts to combat polio in the region. UNICEF is working with the World Health Organization and UNRWA to vaccine up to 640,000 children in Gaza after there was one confirmed case of the polio virus. The ongoing fighting between Israel and Hamas, however, has made medical efforts difficult. Fox News senior national correspondent Kevin Cork has more.
$1.2 million doses of polio vaccine have been shipped to Gaza with the aim of vaccinating the country's youngest and most vulnerable. UNICEF is working with the World Health Organization and UNRWA to vaccinate up to 640,000 children in need.
The objective is to lead a large-scale vaccination campaign.
Last week, the first polio case in a quarter century was confirmed in the region. And according to the health ministry in Gaza, the virus was detected in wastewater in 6 different locations last month. Polio spreads fast, especially among unvaccinated children under 5, causing flu-like symptoms, paralysis, and even death.
To describe the situation here, it's just catastrophic.
The ongoing war between Israel and Hamas militants continues to challenge humanitarian efforts across Gaza and worsen living conditions.
We're tired of the life we are living. No food, no drink, no medicines. There's not any personal detergent or even public detergent. No soap, no chlorine, no disinfectants, nothing available.
UNICEF and the WHO say a minimum 7-day pause in the fighting would be needed to distribute the vaccines.
Over 3,000 people in total will be working on the campaign, over 1,000 of them drawn from UNRWA, which is essentially the largest primary healthcare provider left in the Gaza Strip.
The Israeli government said the vaccine campaign will be conducted in coordination with the country's defense forces. In Washington, Kevin Cork, Fox News.
Thank you to Kevin Cork for that reporting there. Earlier this week, we did see officials with the World Health Organization discuss their efforts to help combat polio in the region over in Gaza. Let's watch some of that briefing next.
Technology by our colleague and our friend Rick Pieperkorn, who, as you know, is the WHO's representative for the occupied Palestinian territory. As I understand, Rick, you are briefing us from Gaza, and he will speak about the health situation in Gaza and what the UN team on the ground is doing. So, Rick, please, you have the floor, and then there's some eager people waiting to ask you questions.
Thank you very much. Can you hear me loud and clear?
Perfectly.
Okay, well, first of all, greetings from Gaza. I'm here actually in the WHO office in Deir al-Balah. And I want to update you first on the polio campaign, and then I want to update you a little bit over the general health situation. Well, first of all, a 2-round polio vaccination campaign will actually start on the 1st of September in the Gaza Strip. During each round of the campaign, the Palestinian Ministry of Health, in collaboration with WHO, UNICEF, UNRWA, and partners, will provide 2 drops of the novel oral polio vaccine type 2, so-called NOPV2, to more than 640,000 children under 10 years of age. The Ministry of Health, WHO, UNICEF, and UNRWA and partners, that we are ready to deliver. Actually, when we speak here down at WHO, there's a so-called Polio Emergency Operations Center, and a technical team is still actually meeting and preparing and planning and how to have the preparation and to complete 1.26 million doses of vaccines. And so 1.26 million doses have already been, they are in Gaza, including 500 vaccine carriers. 400,000 additional vaccine doses will arrive to Gaza soon.
Rick, hold on a second. Yeah. Somebody is not muted on this call. If
20 Friday peace agreement ended the troubles in Northern Ireland. The UK government conservatives.
Can I ask the engineers to mute whoever that is? Thank you very much.
All right, we're listening there to part of this briefing with the World Health Organization. We're going to continue, though, to speak on this topic and really what it takes to combat polio in a region. Now I'd like to bring into the conversation Dr. Peter Ching-Hong, an expert in infectious diseases. Peter, I'd like you to start by telling our viewers a little bit of an overview of what polio is and how it affects the body.
Yeah, so polio is a virus. It's spread through eating it or through the oral route. So you can get it from secretions, so you have to swallow it. It's called an enterovirus. So entero comes from the gut. So you can also pass it through the stool and infect others in that way. And that's why if you have poor sanitation, people who have polio can spread it in the wastewater and then affect other people. The reason why it's so important is because you don't just get over it. Some people can have more serious consequences, like that case in Gaza of paralysis. In fact, in the 50s, the reason why people like grandparents' generation would remember this so well, or even parents' generation, is that almost 500,000 people around the world either died or paralyzed because of polio. So it's not something to dismiss easily. And I think part of the reason why this is getting so much attention is because it's not only about Gaza's risk, it's the risk to the surrounding countries like Egypt, Israel, etc., and the rest of the world. So most people get over polio. Many people don't have symptoms. About 10% of people have like a flu-like syndrome. About 1% of people have meningitis or an infection of the brain. And then less than 1% of people can go on to have paralysis. That can affect the respiratory muscles too. So that's why people can't even breathe. And that's why, if you remember those old pictures of iron lungs, kids in iron lungs, where they would try to breathe for the kid with polio.
Peter, a place like Gaza hasn't seen a case of polio in decades. So how did it even come about?
Yeah, so what happens very easily, actually, is that people might have heard this concept called herd immunity. And herd immunity, if you vaccinate enough people or enough people have immunity, it protects the vulnerable people in the community. If you're not continuing to vaccinate people or vaccinate children in particular, that herd immunity or the number of people with immunity against polio drops. And so that a lot more people are vulnerable. So during the conflict, they weren't able to keep up with vaccinations. People were moving around, a lot of refugee camps, no immunization programs. And all of those young kids weren't able to be vaccinated. There's still polio circulating. So polio takes advantage of that weakness in the system and finds the people who don't have immunity. And that's how it spread.
Peter, how grave is it to find even one case of polio within a community?
It's very, very grave because it is the tip of the iceberg. If you think about an area of war and conflict, you don't have a lot of clinics operating. You don't have a lot of hospitals operating. So there may be a lot of people or a lot of kids in particular going undiagnosed. We do know that it's in the wastewater. In 2022, if people might have remembered, there was a case in New York of somebody who got polio and that person didn't even travel internationally. So what happened is somebody came into the region from abroad and was able to spread it through the stool, and that person acquired it because that person was unvaccinated. So that's why that one person means a lot to the region, because it's just the tip of the iceberg, and because you're finding it in the wastewater, and because you can spread it through poor sanitation, through eating it essentially, it is much more than meets the eye.
I want to pull up a tweet here from Fox's Trey Yings, Peter, because I want to talk about treatment efforts going forward. Here he says this: humanitarian pauses will allow for 640,000 Palestinian children to receive polio vaccines in Gaza. 1.3 million doses of the polio vaccine entered the Strip through the Israel-controlled Karim Shalom crossing. Another 400,000 doses will enter Gaza in the coming days. Talk to us about the process of treating polio. How many vaccines does it take? Do people need to quarantine? How does that work?
Yeah, so the polio vaccines actually are many more than 2 doses per person, which is kind of the average when you look at these numbers. In fact, in the US, you might give up to 5 doses. Some WHO regimens are up to 4 doses, at 2 months old, at 4 months old, and then subsequently. So I think, if you get 1 dose in, you still have some immunity, but it's really the beginning of what needs to be done. And I think some people are worried that, sure, you can probably administer a lot of first-time doses to kids, even if you can get a hold of all of them. But getting second doses, third doses in is probably going to be challenging because, again, you have to negotiate with people to have ceasefires to then administer these vaccines. But again, like somebody said, the key in polio is finding polio somewhere puts everywhere at risk because it's not just, respecting boundaries or war zones. It's really regional and global.
I want you to elaborate on a point that you made here. What happens if someone only gets that first dose and misses their second dose or the other ones that they need to be cured?
Well, you don't have enough immunity. You're probably getting less than 50% immunity. And remember, you need to have herd immunity in the population, which is more than 90% of people having some sort of immunity. The chances of getting immune after 1 dose is smaller. It's still better than nothing, but you really need to get to several doses to get enough certainty that that person is going to be immune. Also, the immunity would wear off if you just give 1 dose, even if you got immunity. So that's why several doses are given over, while for children.
I like that you mentioned that because it segues to my next question. We talk a lot about treating children with this vaccine. How do we treat an adult? Do they suffer the same side effects or effects from this virus as children do?
Yes, adults can have the same effect. Of course, it's more common in kids because kids are all over with secretions and eating things. And again, this is a virus that affects the gut first before moving to other parts of the body, like the brain. But adults can get it. In fact, that case in 2022 in the United States was an adult who got it. That adult was not vaccinated as a child. And the reason why it was a big deal in the United States is because, as we had talked about in this news channel before, Karel, immunizations at the kindergarten level, routine immunizations are dropping so that not enough kindergartners are getting routine immunizations. That leaves the community at risk. In the old days, if you get above 90%, even if somebody didn't get vaccinated, there would be a line of defense if it got into the community. If you don't have enough people vaccinated, the virus can kind of find the fractures or the points of weakness and get to vulnerable people. And that's what happened to that adult in 2022 in the United States.
Peter, one final question for you today. What does the timetable look like when trying to temper this situation and preventing it from getting worse?
Well, I think this is a first good step. And actually, a lot of people were pleasantly surprised that it was seen as a priority by both sides. And I think it speaks to the fact that polio is not about Gaza risk only. Polio is about a global risk because, again, if you have enough cases, it's going to spread. And because it causes disability for life in some people, if not death, these are, a future generation being taken out of society for a long time. So, I think it's the beginning. Hopefully, we can see more of these efforts continue, and not just polio. We have to think about the other childhood immunizations as well. there's also measles and other communicable diseases, I think, that are very common in warfare.
Dr. Peter Ching Hong, infectious disease expert. We always appreciate your time here at Live Now from Fox. Take care. Talk soon.
Bye, Karel.
I do want to bring up a tweet here as we continue to follow the latest out of Gaza when it comes to polio and the vaccinations there for all of the children that could be affected. Here, a tweet from the World Health Organization saying 10-month-old Abdul Rahman is Gaza's first polio case in 25 years, a stark reminder of how war steals futures. WHO and partners are planning a 2-round vaccination campaign to protect 640,000 children. Every child deserves a healthy future. We'll be back after this.